And so this is very good. If you can go ahead and please, hi, how are you? Yes, if you can turn your phone the other way around so that we can, yep, there you go. Okay, wonderful. And I'm going to go ahead and up this. Pleasure to have you on. And so we're going to go ahead and get started shortly. So I will go ahead and just do a brief introduction and we will then get you on. I'm Dr. Shaher Khan. I'm a board certified general surgeon and also a board certified burn specialist. I've been trained in burns. And now I don't do any of the burns. And now as a board certified plastic surgeon, my practice is exclusively devoted to removal of saline implants, silicone implants, and residual capsules. So having said this, I'm going to have you please introduce yourself, and then we'll go ahead and get started. Okay. Now, please tell us more about yourself. What led you to getting the implants? Okay. Maybe, maybe not. I'm not sure, to be honest, but I see you and I believe you're on. And so if you can just see yourself, you can continue because I am seeing the you and I in a divided screen. So this is good. Sure. Now you're very young to get breast cancer in 2020, so this was 5 years ago. Any family history of breast cancer? Any family history of breast cancer? Got it. So I just want to go ahead and educate my listeners. Majority of breast cancer is spontaneous, meaning it doesn't necessarily run in the families. Now, if the 1 out of 8 or 9 women are going to get breast cancer, and we are seeing that this is a very significant number. So if you have a stadium full of 80,000 women, if you will, 10,000 in their lifetime, that's 1 out of 8 or 9 will get breast cancer in their lifetime. So this is where what you mentioned is very much key, a self-monthly breast exam. Right up there, right after that is a mammogram. Now it does have a miss rate of 8 to 13%, but this is where a mammogram certainly has picked up on a lot of patients who have had microcalcifications before you would even feel it on your self-monthly breast exam. Sure, but so there are millions of ladies who have had early detection of breast cancer where they did not have a self-monthly breast exam, and it was only the mammogram that led to basically ultimate the diagnosis of breast cancer. So mammograms really work. Unlike, yeah, and you know, so this is not the perfect test, but remember, whenever you're screening and you have millions of ladies, patients who are going to get breast cancer, a mammogram is relatively very effective screening tool. Now, ideally, you know, you then have the ultrasound, you have the MRI, then you have to do a biopsy. Now, this is where you have to be hyper vigilant, very cautious, and very comprehensive and thorough. And just like you said, the self-monthly breast exam is the number one, and right up there is also the mammogram, very much key. Now, I just want to mention also, I have talked to a lot of ladies who are interested in doing what are thermograms. And I will tell you, I myself have never ordered a single zero thermograms. And I want you to Google the sensitivity and specificity of doing a thermogram and picking up on breast cancer. It is 30 to 50% miss rate, and this is too high of a number, not practical. Do they do thermograms for lung cancer, for pancreatic cancer, ovarian cancer, for uterine cancer? No, correct? And the bottom line here is it is not the standard of care. Whereas mammograms, yes, it's not a perfect test, but this is certainly a very, what's the word to use, relatively effective imaging modality. So please go ahead.
Yeah, absolutely. Um, there's just, I don't know, there's so much to tell. So once I had my chemotherapy and I ended up having the right-sided mastectomy, that came after meeting with a plastic surgeon just to kind of talk about what my options were. Um, so that was, oh, go ahead.
So this was just a couple of years ago, correct?
Yeah, this was all kind of happening in 2021.
Mm.
Was a very long year
So
prior
4 years
to,
ago, yeah. So 2022 you had the diagnosis, 2021 you had the reconstruction. Yeah.
right. So in 2021, I had met with the plastic surgeon for the first time, and you know, um, not knowing anybody else going through what I was going through because I was so young, it's not like I really had met many people yet who had had to make this kind of decision. Um, I tried my best to educate myself, and my surgeon was obviously very well intentioned, but when you're a deer in the headlights, trying to learn what is best for you, when you're trying to survive and you're terrified of this new diagnosis, a lot of things are coming at you, and it's very hard to make these kinds of decisions. So, my angle was I felt like the cancer was taking so much away from me that I wanted to be able to preserve my body um, as much as I could to kind of give myself the illusion of looking more normal. Um, so I decided to go ahead with the process. I didn't really know much about other alternatives to implants with reconstruction, like taking other areas of your body to graft the area and whatnot. And the surgeon that I went to, he said he didn't even do any of that kind of stuff. And it just maybe in retrospect, I would have looked into that option more. I don't know, but
Sure, if I may, yeah,
that's
if
what went down.
yeah. So if I may mention, there are essentially three choices, if you will. Number one, flat chest. Number two, majority of breast cancer reconstruction, well over in the approximate 90% is breast implant reconstruction. Relatively reasonably fast, and pretty much getting the tissue expander in with the alloderm, and then getting the size that you desire and want to match the other side. And then ultimately, number three, like you mentioned, this is where we take your own tissue, be it the belly, which is the deep flap, deep inferior epigastric perforator flap, which is the DIEP flap. There are other flaps from other parts of the body where they literally detach that fatty tissue, and then in a 6, 8, 10, 12, 18 hour, depending on the length of the surgery, if it's one side or both, and depending on the surgeon's proficiency and the workup, where your own native tissue is taken and basically taken from the belly. So you essentially get a tummy tuck out of it, and that is used to reconstruct the chest. Now, there are very few surgeons who are trained to be doing it regularly, and they have to be at a major medical center. No person, no plastic surgeon in private practice would want to do it, because if you're doing 6 at 10 hour surgeries, and God forbid at 3 in the morning you finish and the flap goes down, which is does happen, you have to be available the next day, or your co-surgeon or someone else is going to be able to come and help and assist you. So you have to be at a university or a major mega setting where you have an ICU setting. You have a whole team, ICU nurses, you have a dedicated approach so that you're monitoring the flap literally every hour for the first night or 2 nights. If the flap goes south, some of the sutures are cut in order to allow for optimization of the blood flow to the flap. It gets kinked, you have to go back and quote redo the flap. Sometimes there's venous congestion, and believe it or not, they put leeches on top of this in order to kind of allow for optimal post-operative recovery if there is venous congestion. So there's many that this third surgery is very tricky in a sense. It has to be done by someone who does at least two of these in a week so that you're proficient enough and that you are able to do and handle the complications that sometimes inevitably occur, but you're able to handle the flap. So this is a big deal surgery, and only a select few surgeons. So in my practice, I would dare not do it because my practice is not at a major hospital. I don't do it routinely, and this is the type of surgery where the surgeon has to be very well experienced into doing it, and he has the right setting so that if anything goes south 24/7, be it on the weekend, within an hour or two you're back into the operating room and you're saving the flap, which does happen. Now the good thing is when this flap does take, it's a permanent fix, if you will. Now even in those cases where the flap was done, you can get fat necrosis. Some of the flap may die because some of the blood flow did occur on one part or the versus the other, and this is where you need to go seek consultation from a board certified plastic surgeon who does this routinely. Now one thing I want to mention, what you kind of mentioned very clearly, is that once you are given the cancer diagnosis, your mind goes numb. Anything you hear, you process, it's different because you're cancer, 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 and now you have to take someone else with you, your significant other, your sister, your mom, your best friend, so that they can process for you, because they will then move you to another room, to another room. What chemotherapy do you want? What? And your mind is literally like, okay, where do I jump? What cliff? Where, meaning you're not thinking rationally, because I've seen and managed a lot of patients with breast cancer in my training as a general surgeon. And unfortunately, when you hear the word cancer, your mind goes numb and it's not processing information.
That is so true. I remember my husband being with me in the waiting room. I literally handed him the sheet of paper with all the side effects of chemo. I'm like, I can't look at this. I can't process this. So yeah, the reconstruction and the surgery was certainly another whole aspect of that. And the surgeon, we went over some of the risks, and he told me there was a black box warning. But the message that I got was that, that just has to be there because of all of the concerns that had gone on back in the 90s when they took it off the market. I think that's when they took it off the market. But and then put it back on with the black box warning. And so he was basically telling me that things are better now. There aren't as many issues. Like certainly there's risk, but he made it sound like it was so minuscule. Like I just was like, okay, I can do that. And the other thing too was, he was just kind of encouraging me that he'd had so many patients, and many of them, did just fine. Could have implants in for 20 years. Um, he was saying the gummy bear implant was less likely to leak. So I mean, like all these things were just reassuring any fears that I had. So it just kind of was like, just calming me to just be brave to go forward. And so yes, in the pamphlet, it said things like some women have a systemic response, but like nothing about really what that means. Like, I was not digging into what that meant. I was like Dr. Khan said, just trying to figure out what I have to do to get my life back, figure out what I have to do to just get over this hump and move forward, not have cancer anymore. When you have cancer, you have this battle with trying to get back to how things were instead of kind of learning to just adjust as you go along the journey. And so I was definitely one of those who just would put a lot of trust in my doctors. Um, really felt that, especially where I live, that there's a lot of good doctors, and there certainly are, who definitely want to see. well. But at that time, I felt like I was a lot more naive to the bigger picture.
Mhm.
Um,
So you got a right mastectomy, you got chemotherapy, your lymph nodes were negative, correct?
Correct.
Right. So you did not get radiation, and then you ended up having alloderm reconstruction, correct?
Mm.
So alloderm is cadaveric skin that is used to hold the implant. There, it's a very thick, essentially skin from a cadaver, a dead patient, if you will, processed where the antigens have been essentially washed off so that your body is not going to reject this. And then it is used to hold as a scaffold the implant itself. Now, that is used a lot, almost 2/3 of the time. Again, surgeon preference, and you had a relatively large implant, correct?
Yes. Yeah. My implant, to be fully honest, I do not recall whether it was ever discussed with me how big the implant would be. You know, there's a lot of discussion about symmetry, which is why I ended up having multiple surgeries because there was an infection at one point of the expander, which they put in to stretch the skin after the mastectomy to make room for the implant. I ended up having a latissimus flap where they took in a separate surgery, took muscle from my back to wrap around the front to kind of, just kind of widen the area. I had fat grafting from my stomach, from my abdomen, up to the chest area. There's a lot of measures taken over multiple surgeries, and having to start over when I had an infection with some of that. I ended up having a total of 7 surgeries.
Wow. Now, I just want to mention when someone gets an infection, it's all about bringing blood supply to the area. Now, you never were radiated, but because of the cadaveric, i.e., the alloderm that was used, because of the tissue expander placed, you were above the muscle. So more chance for an infection when you're above the muscle. And the fact that you, because you got an infection, your surgeon brought in blood supply by the latissimus muscle that is, the roars, basically when they roll, this is the muscle that gives the upper body like the V chest, if you will. And so that muscle was brought down to bring in blood supply to an area so that when you have good blood supply, less chance for infection, less chance for problems. And so this is the reasoning behind where, again, same thing, fat grafting. Some of the fat takes, some of the fat inevitably dies, some of the fat may be an itis for potential infection. Now, remember, anytime you go and you cause more scarring, more scar tissue, especially in the proximity of nerves. Now, over how long a period did you have these 7 surgeries?
Um, so, do you want me to kind of give a very quick timeline,
Yeah,
or
if you can give a timeline, because this is significant. Remember, one surgery leads to the next, you justify it, and you're like, well, this is what I need to do, I guess, because we need the best results.
boy, do I wish I knew more before all this. But anyway, yeah. So I had the mastectomy, um, and the first tissue expander put in April of 2021. And then in July of 2021, I had the infection and was hospitalized for 4 days with IV antibiotics, but they did not take out the expander at that time. The infection continued to persist even after, courses of oral antibiotics at home. So in August of 2021, we ended up deciding to take out the tissue expander, which had infection all over it. The doctor said it never would have gone away with antibiotics. He said, it's what he told me.
Right, the treatment here is removal of the foreign body, which is the tissue expander, because no matter how much, a truckload of antibiotics, you cannot salvage it, and they genuinely gave it the best shot.
Right. Um, so then in August of 2021, I had it removed and I was flat on that side for a while, which was pretty devastating to me. Your mental health goes through so much through these changes. Um, and then uh, December of 2021, they put an expander back in. So then the next, with follow ups with my surgeon, we're looking at the symmetry. He's like, I could do a latissimus flap. So that's where, he offered me the option. First time he ever offered me this option front. So I ended up having that surgery done in July of 2022. That was a 6 week recovery. And then there were still, oh, sorry. And then in December of 2022 was when I got the permanent implant put in. And my very first post-op visit, I remember telling the doctor that it felt really heavy, like too heavy, felt awkwardly heavy. He's like, probably still having some swelling. Let's see how it goes. Months, later, just another follow-up. Still the symmetry doesn't seem right, but I don't want to have any more surgery at this point. It's just been a lot. So he mentions he could do one more surgery to try to help with the symmetry, which was another fat grafting surgery. I waited a year, over a year to have that done. So I ended up doing that just last year in June of 2024. Um, and that was a fairly quick, straightforward surgery. Aesthetically, I got to where I wanted to be. Unfortunately, in my case, my healthy breast is on the large side, so naturally, I have a large implant. Um, and had no idea, honestly, that it was the heaviest one that they make.
800 cc implant. Yeah.
That heaviness, that awkward heaviness, never really went away. Um, and just it's since things kind of shifted with me, where I started to see symptoms of breast implant illness. That was really the first time I really paid any attention to how big it actually was, and the fact that the larger implants tend to have more risks.
So absolutely larger the implant, especially when it is above the muscle, essentially the skin and the alloderm is basically what's holding you. It's more at the surface, more chances for infection, more chances for capsular contracture, more chances for all the other problems that one can have with the implants like seroma formation amongst others, because under the muscle it's more protected, it's more deep, it's more secure. With the large implant, even though you have the alloderm, it will stretch the skin out because it is heavy. If you hold the 800 cc, now they make larger implants than 800. I have seen up to a 1400, because the general population is getting larger. The largest that I have removed in a patient is 1200 cc's. Now, the as you will see over time, the skin stretches, and you will see there is effects of the inflammation, the swelling, whatnot else, and the higher the chances that are. Now, at what time? Now, how did the fat grafting overall ultimately do for you?
What that did was it helped eliminate like a concave that was starting to happen in the upper area above the implant. So it just kind of balanced the full chest all the way across.
Mhm.
Yeah.
All right. Now, tell me. So now you're in the 2024-2025, correct?
Mhm.
What's going through your mind now?
So, after that surgery last June, um, about 3 or 4 weeks later, I started having these electric sensations going from head to toe throughout my body during the night. Like I'd wake up in the middle of the night and just be having these electric sensations.
Where were they again, these electric sensations?
They literally, I felt it from head to toe. The best way I could try to explain it is if you had um, like a twinging feeling or almost like a chill, but it's not a chill. It's just like
Mm-hmm.
this stinging, like you feel it like tickling your body as it goes down. Um, so I started having that. I started to have, um, I've had fatigue on and off, but I was having like fatigue of another level. I was having weakness in my arms and legs. If I was just doing simple tasks, nerves. I started to develop pain and numbness specifically the numbness and those zinging sensations kind of happened at the same time in July. And I certainly wasn't putting all the pieces together for a while. So initially, when I started having these sensations, I kind of tried to ignore them. You know, maybe it's just a weird fluke, you know, whatever. Maybe I'm dehydrated, like who knows? I just, you know, I didn't react on it and go to the doctors right away because I was really tired of doctors and knew that they would probably do a full workup if I mentioned these symptoms. So by August, it was just getting to be too uncomfortable, too bizarre. Actually, it was really more the end of July that we decided to start reaching out to doctors. So I just started at square one with my primary doctor. She sent me to the spine clinic, pain and spine clinic, because she thought it was probably related to my spine. Um, and just, you know, a number of things happened. Nothing came out of that workup with the spine clinic. They didn't find anything wrong. Um, and as these symptoms persisted, and the one that made me most nervous was the weakness. Like it would just come on like waves, like right after having these electric sensations. And so I ended up going to the emergency room twice. Um, had everything under the sun tested. They tested me for autoimmune. They tested me for more cancer. They tested me for Lyme disease and all these other obscure diseases I've never heard of. They tested me for different what was things different allergies. So in the course of one hospital visit, I had like all these things under the sun checked. They did nerve testing. Um, they did an MRI, and just everything was coming back okay. Um, so other things I tried outpatient was rheumatology, functional medicine, which is where you have like a combination of traditional medicine, holistic medicine, working with somebody on specifically on trying to look at whether or not you have any toxins. Nothing was really found there. Um, I've been to the chiropractor, the acupuncturist, I therapy, um, psychiatric workup as well, dermatologist, and going back to my oncology team and my surgical oncology team, like nothing.
Wow.
Everything's
So you
very
went to
fine.
all these specialists.
Yes, yes, I did. Because one would recommend another, and I would just keep trying what people are recommending.
Right. Now,
And
what did the rheumatologist say and do? Because remember, this is the one field that is, if you will, the group of doctors after plastic surgeons who understand breast implant illness the most, because the underlying hallmark feature of breast implant illness are the rheumatological joint problems, the fatigue, the autoimmune problems, right? What did your rheumatologist say?
well, she said that as the she diagnosed she gave me a diagnosis of exclusion. She said that they couldn't figure out what it was. She said I probably had fibromyalgia because she didn't know what else to call it.
Mm.
And then she said that to me. She's like, you know, just come back in 6 months. We'll check your labs again.
Right. Now remember, this is like a waste bag diagnosis, if you will. If you cannot think of anything, fibromyalgia, because that's used for ICD-10 billing. And you know, who knows? These are signs symptoms suggestive of fibromyalgia. And this is basically, if anyone's complaining of neck, back, shoulder problems and you've ruled out everything and it's not lupus or Lyme or rheumatoid arthritis, then you say, well, it's fibromyalgia, because that's like a nice diagnosis, and you have something to write down on paper to bill. And unfortunately, this is a very common diagnosis in a lot of patients for that reason.
And I was having neck pain and joint pain and, you know, soreness to the touch, you know, different things like that. Um,
If you put an 800cc implant on anyone, on me, I'll complain of neck, back pain, I promise you. Because if you hold the 800cc implant, even the 400cc implant, you're going to be like, oh, it's heavy, it's not bad. After a minute, your hand is going to be like, you know what, this is like 20 pounds. After
Yeah.
5 minutes, your hands are gonna give, and your neck and back, the trapezium strain, neck, back, shoulder pain, you're gonna have that. And this is where, as you will see, the many patients who have these heavy implants. Even I took care of a lady a couple of weeks ago. She had neck pain issues. So she went downsized from a, I believe, a 400 cc implant to 165, thinking that it's going to put less pressure on the neck. And lo and behold, it didn't do anything. And it was more the inflammation, the referred, whatnot else, and it was the removal of the implant in its entirety. And as you will see, the many patients will complain of the neck back pain issues. They have been to pain doctors, they have gotten steroid shots, whatnot else. They've been to physical therapy, but only when they do remove the implants. Don't listen to me. Listen to the many patients. They will come. They will state that their symptoms improved.
Mhm.
So now here you are. You've been to all these subspecialists and these doctors, and you, lack of a better word, I remember you burned out because you're like, what else is next?
Yeah. So I was just kind of letting things coast. I was on a bunch of expensive supplements. um, I also tried Chinese medicine from my acupuncturist. I mean, I was trying everything. I knew something was wrong. I couldn't go on like this. I tried gluten-free diet, um, because the patterns that I was getting from everyone was definitely chronic inflammation. Um, I was having cascade paralysis during pregnancy. Well, insane.
And you know, if I may, these are all on that questionnaire for someone young like you with all these symptoms that you've checked off on the boxes.
Yeah.
And so this is where, this is very, there's no imaging test, there's no lab test. You've been to all these doctors. Now you have, for someone young like you with all these complaints, now you have more and more fingers pointing towards the implants, because this is essentially a diagnosis of exclusion, because there's no other test, no imaging test, no lab test. And if all the subspecialists are saying it's your in your mind, it's the anxiety, it's the stress, it is the implants, because you got a whole life ahead of you. You're in your
Yep.
40s.
Mhm. Yep. Early 40s. And so, as ladies in our early 40s sometimes do, is we compare stories. And I was meeting with a couple of coworkers one day, and one of them, just kind of hearing some of my medical complaints, um, she was saying that she was wanting to ask me for a while, but had been hesitating because she didn't know if I would be offended. But she just kind of came up to me and said, "Do you happen to have a foreign body in you?" And I'm like, "Oh my gosh, like, you must know that I've had breast cancer. I never mentioned that. Like, did you just come up with this on your own?" And she's like, "Yeah, no, I had no idea you had a breast implant." So she started to tell me that what I was describing sounded a lot like what she'd gone through. She's actually a former patient of Dr. Khan's as well. Um, and she started to tell me about her story with, she had cosmetic implants that had leaked, but it had been, she went through a lot trying to figure that out too. So I was like, gosh, like, none of the specialists in this whole journey had once said, "What if it's your implant?" And so, it was like my stomach sank, like, the earth just went out from under me. I was like, "Oh no, what if this is what it is?" And the biggest part that made me just want to vomit, honestly, was that I had been through so much surgery, as I
Mm.
described here. um, so much on my body. I started to feel guilty that I did this to myself, like, um, so there were a lot of initial feelings before I started to research it myself. And then I was like, okay, let's slow down, take a step back, talking to my coworker. Um, Shout out to you, by the way, my friend, if you watch this. Thank you. Um, my first step was to go back to my plastic surgeon who put in the original implant, and just kind of let him know I thought maybe I was, rejecting the implant or something. said, I felt like I trusted this surgeon. I've been through a lot with this surgeon. Um, like I said, with trying to heal and go through all this, I just was trusting that the people whose hands I'm putting my life in are working on my behalf. So I went to the surgeon. I explained to him, there's some really weird symptoms I've had. I've been to the emergency room twice. I've been to all these specialists. My hair is falling out. I'm getting this feeling that like nobody believes something's wrong, and I know there's something wrong. These things don't just happen. You don't just imagine your hair falling out. Um, so his response was very strange and unexpected. Um, he was really quiet. He did not answer me right away. He stood there with his arms folded, leaning against the wall. And then he said, there's a lot of women who convince themselves that they have what's called breast implant illness. Those who convince themselves that they have this, if they choose to have the implant removed, that's usually the only way to see if, that helps anything. He said 1/3 of them feel better, 1/3 of them feel worse, and 1/3 maybe have no change at all. Like he kind of really brushed it off, making it sound very psychosomatic. Um, I literally was tripping over my words. I trust you to try to give me some guidance in what to do next. And he was quiet again. He did not say anything. It was like the most invalidating, embarrassing experience I've ever had with any doctor, and just such absolute disappointment because I was looking to him for guidance. But he was just silent for a while, and then he finally said, he's like, I could take it out, but I don't take out the whole capsule. People say you need to take out the whole capsule, but I don't, I don't believe that's necessary. But I can take it out. Like he seemed like annoyed and bothered, and yes, he did a lot of work and spent a lot of hours on my surgeries. So, um, yeah, I just,
See, this is the underlying problem. The patients have a complaint. Don't listen to me. Listen to the system. The patients have a genuine complaint. You have nothing to gain out of this, right? The complaints are there, and it's a mountain of complaints. It's not something, hey, by the way, it's a little bit. No, it's altering your life, right? It's affecting your day-to-day life. No one is listening to the patient's complaints. No one is listening to the the very classic, if you will. All the doctors have ruled out all the diseases, and no fingers are pointing towards the implants. They're not even in the consideration. No one's even factoring that into the equations. The patients are disregarded. They're saying it's a social media phenomenon. Guess what? The implants were banned from 1992 to 2007 for a reason. All the ladies who are coming forth complaining of breast implant illness, the heal is real. That is not a coincidence. This is not a placebo effect. You're not here on Facebook Live today to get more Instagram views and get a, I could care less, to be honest. I'm trying to raise awareness, right? And so are you. And we're just trying to say your journey is very similar to the many others, some younger, some older. And if you look at this, is the same pattern recognition. All the labs are normal, all the imaging is normal. You just got your implants 3 years ago. Your body is going haywire, and literally you're losing your mind. And they're saying, well, it's a social media phenomenon. You're going to be a placebo effect, and don't fall into that trap. You didn't make any of this up. You're looking for answers, and according to, as a board certified plastic surgeon, the plastic surgeons need to open their eyes and ears and say, when they recognize this, a primary care doctor or emergency room doctor, and look, very classically, it's your friend, your coworker who's guiding you. And this is very classic. All the plastic surgeons are saying, of course not, it's the implants. And now the patients are taking the executive decision in their own hand about proceeding with an explant despite what their local plastic surgeon is saying. And this is the same phenomenon that's repeating itself. And you are now directing your health care and whatever your doctors are telling you. Now, I find that you go to the emergency room. What does an emergency room doctor know about breast implants? What do I know about about what do I know about an emergency room treatment for, let's say, a rheumatological problem or a cardiologist problem? What do I know about looking and reading a EKG? What do I know about managing? Zero. I know zero. I will dare not treat a patient with heart issues or patient who's having a heart attack. I know, like, you give the aspirin, you give, like, morphine, you basically, oxygen, you get pain control, just the very basics. But I'm not a cardiologist, I'm not a pediatrician. Likewise, I do not expect a primary care doctor, probably who's never even touched a breast implant in their life. Or now, if this is where we need to educate the primary care doctor, the nurse practitioners, that if you have patients complaining of these symptoms and you have these check boxes despite all what the workup is. Now remember, there's only 20, 30 different labs you can do. But if you have a patient who have all these symptoms that are checked off, it is the implants, but till proven otherwise, because what else would it be? The other way to circumvent this problem is put a band-aid on, give prednisone, or give something that's going to calm the immune system down. One patient ended up getting tacrolimus, which is a transplant medication to suppress. Another patient got prednisone. Another patient got pain control meds, believe it or not, chronically over the years, just to suppress the neck back pain issues. The bottom line here is, it is the implants, it's the implants, it's the implants. And this is what the FDA is telling you, that if you have these symptoms, go seek consultation from a board certified plastic surgeon who will listen and honor and say, well, it truly could be your implants that are causing you the hurt.
Yes. And my primary doctor, when I started to put the pieces together and I mentioned it to her, she literally told me she did not know what breast implant was. She had never heard of it. Breast implant illness. She'd never heard of it. And she was very supportive though. She definitely said, see what this specialist Dr. Khan has to say. Which was a very good.
Oh, so she knew about me?
No, I told her
Oh,
that you were the one I was
got
going
it,
to
got it.
refer
Okay,
to.
got it. Now, again, the word is spreading and we're trying to educate. Hopefully, one day I'll give a lecture to the internal medicine conference or a local grand rounds. The word is spreading. Look, and you know who's spreading the word? The patients. The patients are helping the patients, not the doctors, not the plastic surgeons, not, and sometimes the social media, Google, Instagram, self diagnosis by AI. I have the last patient I just saw, this was the reason for the half-hour delay. On August 11th, I have a gentleman who saw his wife hurting, miserable, all the symptoms. He literally was up most of the nights, put all the symptoms together, and he went on Google and he said, guess what, honey? It's the implants. And lo and behold, his wife was not convinced. And he himself brought his wife to me and we discussed, and I said, listen, it's a diagnosis exclusion. And believe it or not, we're going to hear from her on August 11th, the remarkable improvement that she's had. And we will see what happened to you. Now, as you're going through all of this and you're researching breast implant illness, how sure were you or that this was indeed what was breast implant illness that was affecting you?
I felt probably 90% sure because of all of these other workups I had tried, because I knew how I was feeling. I knew I wasn't making it up. And when I saw your list of symptoms and I was just checking it off, I'm like, oh my gosh, like how do I have so many of these? So I'm like, really, I decided that, even if there was a small chance that it wasn't the implant, I was willing to take that risk because if even a couple of my symptoms subsided, it would be worth it.
Mm-hmm, mm-hmm.
And Dr. Khan talking with you really helped settle my fears about that as well. So I didn't want to go through another unnecessary surgery. So
Right,
that was
right.
huge for me.
Yeah, you had done seven others. Now, you are, if you don't mind, you're 46 now, correct? 43, sorry, I apologize. 43.
That's okay.
You are so young, and if you add uh, 30, 43, 36 years to your life, that's the age of the current president. The point I'm trying to make here is you got a whole life ahead of you, and look what type of misery you were going through. Now, yeah, so now you're like 90% sure. What research did you do in order to say, you know what, okay, I'm gonna go here? Like, what type of networking did you do? Like, how did you educate yourself?
So I did a little bit of research to kind of figure out whether to um, go through with this. I was reading um, a lot of breast cancer websites. I talked to some of our local breast cancer coalition representatives here in Rochester, an advocacy group that we have here for breast cancer. They were saying they were starting to hear more about the breast implant illness, so things like that were helping to validate, as well as talking with my oncology surgical team, not the plastic surgeon, but the oncology surgeon who did the mastectomy, the removal of the cancer. Um, the nurse practitioner there was very validating, and she said, I've been starting to hear more patients talk about this. She wants me to send her a message this summer to update her on how I'm doing. Where I thought she was gonna, think I was crazy like some of the other providers were, or unique field. So the main thing though was really my coworker having such an amazing turnaround. I mean, her story I feel like is even more dramatic than mine. Um, and just hearing a first person account for someone who has literally nothing to gain from telling me this, um, it just I just kind of knew.
Right. Now, if I may mention, I'm going to go ahead and take this. Yep. I'm going to go ahead and take this. This is guidance for industry and FDA administration staff. These are breast implants, certain labeling recommendations to improve patient communication. So this is where the surgeon needs to discuss with the prospective patient the risks. And I'm just going to read this out. Systemic symptoms. I understand. So these are the patient initials. This is where you should have signed. I understand that some patients who have received breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, rash, memory loss, and brain fog that some patients have called breast implant illness. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with the removal of their implants and surrounding scar tissue capsule. However, not all patients may experience improvement in their symptoms. And then it says, I also understand that some patients with breast implants have reported health problems in their children and after birth or breastfeeding. Now, it's telling you directly that breast implant illness does exist. And the next line, the next paragraph, and then they want you to sign down here, patient initials. And then, if I may, it says over here, I understand, and I'm reading quote unquote, I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Mammography. Mammography can also cause the breast implants to rupture or leak. I should tell the mammography technician if I have breast implants. And then I understand that the long-term risk of breast implants may include painful or tightening, which is the capsular contracture, rupture or leaking, wrinkling of the implant, visibility of the implant edges, shifting of the implant, and need for reoperation. And this is where, amongst the many other problems, and the point here is we have this in our literature. This is no surprise. So your plastic surgeon should have said, well, it could be BII. Let's look into it because it's in the textbooks. It's in the lingo that the manufacturers are telling us, the FDA is telling us. It's not a surprise. It's not like a small. It is a fraction of patients, not everyone, But this is where once you hear the patients complaining, they should step up and say, you know what, it is the BI. Let's go ahead and look into it more seriously rather than dismiss you.
Hmm. Yeah, my plastic surgeon told me to go get another opinion. So yeah, I felt dismissed for
Yeah.
sure. Yeah.
Now, yeah, no, I will tell you, patients come to me from all walks of life, from all the different states, literally dismissed by their local docs because they feel that they were not listened to. As simple as that. So now, what made you decide that you were going to choose me versus did you get any other consults with another local plastic surgeon?
I did make a phone call to another one who I was told did the M block, the full capsule removal, and I did confirm with them that they did, but they were booking so far out, and I was already like, way beyond. Like I couldn't even imagine going through the symptoms I was having for another few months just to stay local when I could go see Dr. Khan, um, who I already was on the books with you at that point. Um, so yeah, I mean, apparently there there was another one that came recommended to me in Rochester, but it was just too long of a wait.
Now, very important for anyone who is listening, if you go to 10 different explant surgeons, you're going to get 10 different surgical approaches, techniques, drains, lift, 10 different post-op managements, recovery, bra binder. This is all literally on the job training for all of us, including myself. No one taught me. This is where I put the two and two together. I said, I'm not going to do the drains. I'm not going to do the unnecessary lift. In your case, it doesn't apply to you. I'm going to send the capsules off to pathology. 100% of the capsule must be removed. That 100-100-0 rule. I'm going to take cultures for bacteria and fungus. I'm going to return the implants to you. I'm going to take high definition pictures and videos. And the whole gist of the surgery is remove the alloderm and anything foreign, including surgical clips, and anything abnormal, like if there's permanent suture, so that you have what is a true flat chest aesthetic closure minus the inflammation that's present. And if you go, the ultimate take home message number one here is your surgeon must not be putting in implants, because how would they then believe in BI and at the same time be putting in implants? Number two, your surgeon must be showing a video of the chest wall showing complete removal of the capsule and high definition pictures and videos of the chest wall. Very important, because if that's not done, the capsule was left behind. It is inadequate, incomplete to show just cutting open of the capsule implant on the table. And it has to be done with sterile gloves, so you're not going to contaminate the biofilm. So that is very important. Now, now please go ahead. What preparation did you do in order to come to me? Like, how did you prepare for your journey? Because many patients say, well, do I really need to travel? Because I have another local plastic surgeon who said he can remove the capsule. What preparation did you do in order to make the trip?
Um, yeah, it was for me. It ended up being just fairly smooth and comfortable the whole process. But just to mention, as on your comment about the surgeon you choosing being one who does not believe in putting implants in, the surgeon here in Rochester that I considered does put implants in, and so I that was another reason I felt much more comfortable going out of the area from New York to Michigan. Um, so Dr. Khan's office provides a lot of local hotel information, um, and we looked at that. We also I ended up, just because I have such a sweet coworker who went through this. She just told me exactly where she stayed and how comfortable it was, so I was able to get firsthand,
Mm-hmm.
perspective from her. So we stayed at a very nice place that was about a half hour away from Dr. Khan's office. Um, and it was just, we left early that morning. My husband went with me, um, and we had our pre-op appointment late in the afternoon. Relaxed, had the surgery the next day. Um, Surgery was on a Wednesday, so we drove up on Tuesday, surgery on Wednesday. Thursday, it was just healing in this very comfortable hotel room. Um, and then Friday was the post op, and then we rode home. So we were really only in Michigan. We had, 3 nights at the hotel. Um, and Dr. Khan's staff was just incredibly um, accommodating with just making sure we knew where to be when and all of that. Um, and the drive home was a little bit uncomfortable, but to be honest, um, there was nothing that would make me not do it again. It was just, we just had to stop when I needed to stop. Um, I think it was like a 6 hour drive for us. And I just had lots of pillows around me in the car. Um, and pain medication helped, but once I got off the heavier stuff the first couple days, I was good with just Tylenol and Advil. Um, so yeah, there was nothing unpleasant. If anything, it was a very positive experience that I would recommend to anybody.
Sure. Now, how was your anesthesia experience?
That was pretty awesome, honestly. And I don't know, how could you say anesthesia is awesome? But in my
Mhm.
case, or maybe you could, it does make you feel pretty chill. Um, I've had a hard time with anesthesia in the past where I get very nauseous afterwards. And I've said this to anesthesiologists over and over. And it's only the past couple surgeries where I felt like they were trying to help me with my nausea issue. So then when I went to Dr. Khan's surgery center and met with the anesthesiologist, um, she took my concerns very seriously. And it was the first time that I ever did not get, I got only slightly nauseous afterwards. It wasn't even right away.
Mm.
Um, so she took very good care of me with only like the minimal amount of anesthesia.
Mhm. And we're blessed to have a very good team, and it's the same team that's here pretty much all the time, and we want to make sure that we enhance the twilight deep sedation is the way to go. Now, when did you start noticing improvement, or like how was your post-op recovery like?
Post-op recovery was out of work for 6 weeks, um, doing the T-Rex arms for both of my arms, even though I only had the removal on the one side, um, which was very, very good advice because I'm somebody who has to keep moving. I have a really hard time staying still and letting other people do things for me. So that was probably the hardest part, was just learning. You have to learn how to just move differently.
Very
And
important. Yeah.
yes, and once I did that, with the way that Dr. Khan checks in with you frequently and just asks you to send, photo updates to monitor the swelling, I could also start to see the swelling going down, which was encouraging. So um, I'm still in the binder currently. I'm about 8 or 9 weeks out, 8.5 weeks out. Um, but I have a lot of swelling, and also having had, a number of surgeries prior, having had lymph nodes removed on that side, I'm all about wanting to heal fully and well. So I'm taking it slow as Dr. Khan is recommending.
So between the latissimus flap, that big muscle, I want you to Google the word latissimus and type in on YouTube the latissimus flap. So it's a big muscle that's brought in into the front between the fat grafting, the 800cc implant, between the alloderm, the history of that infection, correct? That certainly adds overall insult scar tissue to the whole area, and the amount of inflammation that was present, because remember that's the epicenter of the badness, right? The fire, or the epicenter of the earthquake, if you will, meaning that's where. And so you're still, imagine you had a 400cc implant, you would have healed twice as fast, right? Or if you had a lot less inflammation, you would have healed relatively sooner or better. Now you're young, 43 is very young, and so you're healing, overall in a very nice, systematic, thoughtful way, again given the nature of amount of inflammation that was present. Now remember, what makes it more involved a recovery in you is the fact that you're above the muscle. Had you been below, your recovery would have been relatively better because the healing would have been more quote deeper underneath, inner, rather than right at the surface. So
Mm-hmm.
now, how many, and what symptoms have you improved from, if at all? Like, how much better are you overall?
Yeah. This is the exciting part of all of this. So, um, I had chronic dizziness for the longest time. That is gone. Okay, smidge still, but it's almost gone. Um, I that chronic fatigue, I do not feel anymore. I feel much more like my energy is where it should be. Um, my husband and my sister say my personality is coming back. My sense of humor is better. My mood is better. I'm able to concentrate better. I was having word finding difficulty, and that has improved. Um, Also, I honestly had like chronic constipation for like a year, and that has also improved. Um, to being normal, which is incredibly important, especially during the recovery process. Um, and then the the weakness that I was feeling in my arms and legs, that heavy feeling, is gone. It doesn't happen anymore. The zinging feeling, that does not happen anymore. I still have numbness in my hands and feet, um, but I do feel like it's slowly improving, and I'm fully aware nerves take a long time to heal. So
Mhm.
um, I'm
Now
still
remember, it
feeling
takes up
that.
to a year, year and a half.
Yeah.
The reason, why I like to do these even like 8 weeks out. I did a nice, wonderful lady from Hawaii last week, the week couple of weeks ago, and because I want to show that this is a very dramatic before and after. Now, let me ask you this, just devil's advocate: do you think this all could be in your head, like your plastic surgeon was telling you?
Not at all. Not at all.
Right? Because yeah, why do you say that? Like meaning,
It's
see the
I tried everything. I tried to just do it on my own, and I couldn't. So I feel like this is just so different. And even things that I kind of forgot were a problem, I've recently noticed they were not a problem. Like I don't really get pain in my hands, and I used to wear compression gloves like all the time, and I have to carry them with me constantly because of the pain in my hands. I haven't put those gloves on in weeks. Like I just and you forget about some of these things. So um, I'm also um, a woman of faith. I have a lot of faith, and I feel like this whole journey that I'm on now, led me to where I was to take care of this implant issue, and it's just I just feel like my body's not fighting anymore. I
Mhm.
feel like it's healing, it's not fighting. If that makes any sense.
Right. Now, one thing that I want to mention here, you tried everything. You,
Yeah.
as a young patient, did everything possible. If you look at the pathology report, it shows that the quote right breast implant capsule, it was sent to pathology. It was read by Dr. Paul Mazzara as a final pathology report, and it shows fibrous capsule with synovial metaplasia and focal chronic inflammation. This is in the capsular tissue, and this is consistent with the inflammation that your body was going through. And this is the inflammation. I can see your face, it is much more healthy appearing. And just like you said, you yourself subjectively will feel the benefit of the explant. Your family members, friends will notice your personality change for the better. The mood swings, emotional instability, the anxiety, sometimes the depression, this brain fog, when it's lifted, the not joint back pain problems, you become healthier, better, more lively, and more yourself. And this is, you know, like one patient said very well, if you could unplacebo yourself many months ago, right? A year ago. And this is not, if you look at the many thousands and hundreds of thousands of ladies who have explanted and the benefit of the explant that they have sought, and you just go to Google and type in explant before and after face, you will see the patients one after another, their face before and after explant, and without any facelift, no lasering, no chemical peel, nothing, no fillers. You will see the faces look better, healthier, more natural, minus the chronic inflammation that is clearly exhibited, radiating from the chest implants to the rest of the body. And it truly does affect all organ systems from the hair down to the plantar fasciitis, and including everything in between, the endocrine system, the vision changes, dryness of the eyes, neck back problems, rheumatological joint problems, like we said, which are the hallmark features, GI disturbances, heart rate issues, blood pressure issues. One patient may not be touched at all, another patient may have very subtle, and this is a very, I use the word evil disease in a sense that it basically hides well. Many surgeons don't want to even consider it, and let alone even talk about it, don't even want to utter the word. When it comes to explant surgery, it requires two conditions from the surgeon. Number one, the physical ability to be able to dissect off of the rib, in your case above the pectoralis major, such that all of the inflamed tissue, implant and capsular tissue is removed. And number two, the mental uh, commitment, confidence, and that religious belief that the entire implant capsule, all inflamed tissue, must be removed sincerely. Because if any of that's left behind, or the surgeon doesn't believe in it wholeheartedly, and when the surgery gets tough and involved, then the surgeon will basically want to fast forward the procedure, skip the capsule complete removal, especially when it's sitting on top of the rib. And this surgery is about being comprehensive, complete, about that firm belief that BI exists, and the whole post-operative course is dependent on the surgeon removing the whole capsule, number one, and number two, testing it so that we know what it is and what it is not. Now, I will please go ahead and share any message do you have for any of the listeners, viewers, any plastic surgeon, primary care doctor, whoever may be listening, significant other, in regards to any message you want to send?
Yeah, I just I feel that more um, pre-screening needs to be done for people considering any type of an implant. I know that there's some peer-reviewed articles out there I've been looking at where they're talking about some of this. Doing some allergy testing ahead of time and things like that. As far as what should be done. And then another thing, that mental health issues should be seen as like a secondary cause of breast implant illness, not the cause of breast implant illness. There's a huge message with this whole idea that it's a psychosomatic um, experience for a person. So I just want the voices of women who just want to live their lives to be heard by their physicians. These we our voices are important. We know our bodies, um, and I just I just can't believe I kind of had to figure this out for myself. I feel like the health system failed me in a lot of ways. So that's a huge message, and also for women considering implants. I know that it's a very personal and sensitive decision, but please do your research. Um, I wish that I had, um, and now I have no reconstruction. I'm just flat on the one side, and I will be using prosthetics the rest of my life. Um, so you know, aesthetics are not everything, as you may fear and think about in the beginning. It's really about your whole body's health and how many years ahead of you have to live a healthy life.
No, very well said. Very strong, powerful words. As a plastic surgeon, as a doctor, as a clinician, as a human, I will say, do no harm. That's the oath I took. If this is a surgery where almost always the patients say two things. Number one, they wish they had never gotten implants. and they wished they had removed them sooner. I said I'm not going to do something where almost all the patients have said this, because sooner or later there's going to come a time where it's going to rupture a capsular contracture, infection, inflammation, BII symptoms, fluid, that rare small BIL, CL, T cell lymphoma, amongst others. And this is where, one will end up, and you just have to be vigilant. And if you're looking for answers and you're not getting it and you're still hurting, please, absolutely, listen to your body. Your body will not trick you or deceive you, and your body will let you know, just like the 75-year-old lady who reached out to me and said, I know it's my implants. And the whole system kept telling her, it's probably your old age, it's the dementia, it's the joint pain, it's the arthritis because of your age. And she knew better, that she took the decision in her own hand, and she explanted, and lo and behold, it was a ruptured implant. Look at the lady I did a Facebook Live with from 4 weeks ago. She came all the way from Washington State, and she had two internal, separate, discrete collections. Or the 89-year-old lady who came in with a lot of fluid on the right implant that she had from 1973. That 52-year-old set of implants. She knew that this was not right, and no one should have to live with this. And if you have a problem, we want to educate in a very professional way that there is a problem and a defined solution. And if you're considering implants, please know what you're signing up for, so that when a problem does occur, you jump right on it and you take care of the matter and you put out the fire right away, rather than dealing with it and living through the misery of what is, the hurt that the implants ultimately cause. Now, thank you very much. I will end with myself, and I will let you say the final word, please.
I just want to thank you all for listening to my story, and please take care of yourselves as well.
Thank you, thank you. You had, I have to say this. A group of plastic surgeons approached me and said, "What are you doing?" I said, "Don't listen to me. Listen to my patients. I'm helping my patients. If I wish, I sarcastically I say, I wish I was putting in implants. My neck will be better. My hours will be better. I would definitely be doing a lot more surgeries in 1 hour rather than the 4 or 5 hours that it takes to doing the surgery, which is very tedious, very cumbersome. And I will tell you, not at all financially rewarding, if you ask me, compared to the time it takes to putting one in. And the bottom line is, do your homework, listen to your inner sixth sense. Your body will never deceive you. Take care. Thank you very much for sharing your journey. It was very strong. Thank you. Take care.
Thank you.
You're
Thank you
welcome.
so much,
Bye bye.
Shaher.
Bye bye.
Bye bye.
Bye bye.